My name's Bridget Organ. I'm the manager of St Vincent's Mental Health in Melbourne. Mental Illness Fellowship Victoria approached us to be one of the clinical services involved in Doorway. This meant that we would be involved in selecting and supporting up to 10 clients to access the private housing rental market through the Doorway project. So in practical terms, this means that we have a collaboration with Mental Illness Fellowship Victoria, whereby their Doorway staff are attending the Community Mental Health Centre where the project is focused, and working with our clinicians to identify 10 potential clients to access the housing. So it's very much working in partnership, so providing support to the clients, working with not only the housing support staff, the peer support workers, and bringing those clinical staff together to essentially support the process and enable clients to access the private housing rental market. The benefits of working in this way and having the clinical service and the Doorway project working in this collaboration as part of a team, if you like, within the clinical setting means that the support to the clients is very integrated. It means that the housing workers can focus on supporting the person through their housing because it's up to 3 years that they'll be provided this support. It means that the clinical service can focus on the clinical aspects and really integrate that support to the person without having to separate it out and losing traction in that way. It also means that the client can meet with the housing support and the clinical support and do that in collaboration rather than having to talk to different people at different times and having that very disjointed kind of relationship. So far, the health outcomes for clients is that we have 10 clients who now have housing in the private rental market, which would have not been within their grasp before this project came about. This means that they can now continue to work on their goals and aspirations. Now they have some stable housing. It also means a great deal for the individual, because to be able to access private rental means that you start creating a rental history, you start to be able to demonstrate your ability to manage your finances and manage your day-to-day living, and it really gives someone a great boost to themselves and their, it means that they can move on and achieve their goals. It really is very fundamental to making that leap into another way of living as opposed to being on waiting lists for public housing or living in rooming houses. It's a significant move for individuals.
Hi, my name's Ruby. I work for the Doorway program of my fellowship, and I also work here at St Vincent's Mental Health Clinic. So as part of the Doorway program, I'm a housing and recovery peer worker, which means I've had a lived experience of mental illness and housing stress as well. I support clients to try and find housing, clients of the Clarendon Clinic here, and support them together with their case manager at the clinic to settle into housing and move forward in employment or other goals in people's lives. So at Clarendon Clinic here, I'm in a part-time role at the moment and spend half a day to a full day here, meeting participants who are also involved with case managers here at the clinic, have team meetings and integrated implementation meetings to see how the program's running across Clarendon Clinic, St Vincent's and MI Fellowship. Well, usually when I'm not at the clinic, I'm out in the community with participants, supporting them to move forward in their recovery, get to know their local communities, where their local services are, where their local cafes are, different things that they're able to access around the area to make them feel like more like they belong. The relationship between my fellowship and St Vincent's here means that I can support participants if they're coming to the clinic in their meetings with case managers. I know who their case managers are and can inquire about any about their mental health care here as well, and we can have a more holistic method of supporting participants to actually move forward in their recovery in sustainable long-term ways past their involvement with both of us, which is the ultimate aim.